Hello and welcome to the Valley. Today, I am your host, Janet Michael. We're going to get all of the details today about the Housing Summit that is happening on Friday, May 29th. So I am on the Zooms with Kim Herbstritt. She is the Executive Director for Blue Ridge Habitat for Humanity. And Kim, you guys have been doing this Housing Summit for quite some time. And when I say you guys, what I mean is the Housing Coalition of Northern Shenandoah Valley. Before we get in the weeds on the Housing Summit itself, can you give me some background on the group?
Yeah, the Housing Coalition actually started, I think it was back in 2018 or 2019, and it was an effort between United Way as well as Blue Ridge Habitat. It's designed to really mobilize the community to positively influence and address housing challenges in the Northern Shenandoah Valley region. And actually, this year, will be the 8th annual Housing Summit. And each year we've tried to focus on a different aspect of housing. The Housing Coalition focuses on affordable housing, but really also looking at the whole continuum of housing, because we know that there's desperately a need for affordable housing, but there's also a need for housing for families or individuals between like 80 and 120% of the area median income, and even higher, more luxury housing. So although the Housing Coalition really focuses on the affordable piece, we do recognize the needs along the whole continuum. It's a pretty diverse group of individuals and organizations that come together that have an interest or a passion for housing and recognize the need.
And you always try to pick some sort of underlying theme so that it brings that topic to the surface, because a lot of times there are tons of conversations that are going on individually in our community and nobody understands how they may tie together. The Housing Summit a lot of times does that.
Yeah, we talk about this in our Housing Coalition meetings. Housing is health. Housing is education. Housing is economic impact. Housing is workforce. If our workforce doesn't have housing, it makes it extremely challenging. They might have to be driving 20, 30 miles to their work, which can be a significant challenge for some families or individuals that are challenged with transportation. I had a conversation with a person back some time ago, and they had said it's difficult to bring businesses to town if we don't have the rooftops or the housing for the individuals that will be working at that establishment. If your house is not a healthy place, mold, drafty windows, leaking roofs, things like that, then there's a good chance that you're having some type of health impacts as a result of the home that you're living in. Housing impacts every sector of a community, and that's what we do at the Housing Coalition, is really, when we're looking at the Housing Summit, is to try and identify what's an area we can focus that can bring more awareness and understanding regarding how housing or the lack of housing is impacted in our communities. And so this year we are focusing on health and housing. Again, as I had mentioned just a minute ago, if you're living in an unhealthy home environment, that can have significant impacts on a person's health. So this year the Housing Summit is titled Housing is Health: Integrating Land Use, Public Health, and Housing Policies. So we're really excited. We've got some good speakers this year that will be addressing the housing is health aspect, hoping folks will come out and learn about how housing is related to health.
Is this open to anyone in the general public? Is it specifically geared towards the, say, contractors who might be building these homes or government officials? Who should attend this?
It's open. It's a free event, as it was last year. We're holding it at Laurel Ridge Community College. We're excited to have it again there this year. It's a great central location for folks in the southern part of the valley. We encourage, if you have an interest in housing, if you're a policymaker, there's certainly policies, zoning that we're hoping that our speakers will come and talk about that can be helpful for our local government, planning commissioners, builders, real estate agents, really kind of runs the gamut. And I think that, as has been the case for past housing summits, that there'll be something that people will walk away with and know more than they knew when they came to the summit. So I would encourage folks, come check it out. Again, we've got some really good speakers this year. We're going to have 3 speakers, and then there'll be an opportunity for a panel discussion towards the end of the day and opportunities for question and answers.
I love that you bring in these speakers and they're not necessarily speakers who live in our area because sometimes we get stuck in our own box and we think, look, we're doing all we can do and there's nothing else to do. And then somebody from the box 10 miles, 200 miles down the road comes in and says, hey, have you looked at this box? That's really what the whole point is of bringing these speakers in from somewhere else is to refresh some ideas.
Absolutely. And two of the speakers are actively doing research on some aspect of health and housing. One of our speakers, Dr. Jenna Kroll, is with the Department of Global and Community Health at George Mason University and has been doing some research on the environmental exposure, pollution and things like that related to housing and the impact on health, housing insecurity, homelessness. So that I think is going to be very interesting. And again, this is research, and I don't know how much folks know about the research that's carried out at universities, but there's a very rigorous review process and approval process that researchers have to go through before they can actually initiate their research. So that's an important piece, I think, for people to understand that this is really intensive work that these individuals have been doing. And then we also have Dr. Antoine Jones, who is at the George Washington University, and he's going to be looking at housing stability, urban policies, influencing cardiovascular outcomes and obesity among marginalized communities. So again, how housing relates to health. And then we have a third speaker that has done an extensive amount of work around zoning matters and the whole power of zoning in shaping our communities related to housing. And she'll be coming and talking, Maria Darty will be coming and talking about housing from a zoning standpoint. Not sure how much folks are aware, but there's been a big effort across the country to create a zoning atlas for each state. And the zoning atlas for the state of Virginia has actually been completed. I can get you the web link if folks are interested in checking that out. It lays out all the zoning of the whole state. I think it's very interesting and probably very useful, again, for our policymakers and planning commissioners and
It's
folks like
also
that.
probably pretty eye-opening for just your random resident who has maybe driven by parcels of land or falling down houses and said, why can't they just? And they
Yeah.
have no idea what has to happen or what zoning is in place.
Yeah, you can do what is allowed in whatever that zoning designation is. And to your point, if folks are ever wondering, why can't I turn this into a house? You'd have to look at the zoning and figure out what that is and what's allowable. And that's one of the things with regards to the housing is really looking at zoning. And so we're excited that Maria will be coming and talking quite extensively about that. Really exciting speakers that will be joining us this year.
I would imagine that through your work at Blue Ridge Habitat for Humanity, things have shifted over the last 10, 12 years or so. Whereas it used to be that all you did was build houses. You built these affordable homes. People had their sweat equity. They were able to get a decent rate on a mortgage, and they were able to have these homes that then turns into the generational wealth we hear so much about. But you've seen such a huge increase in your home repairs through
Mhm.
habitat, keeping people in the homes they can afford to live in now is as important sometimes as building new ones.
Yeah, absolutely. And we actually have a waiting list, sadly, for our home repair. And the majority of the individuals requesting the repairs are typically our seniors living on limited income and own their home and just haven't had the means to do needed repairs. We do what we can based on grants that we're able to receive. And we work hard to try and find any funding out there. Seniors First is a great partner for us, United Way. We're able to take care of quite a few roofs, also ramps and other modifications that our seniors need. But there's always a list. It's just not possible to meet the needs. That absolutely is a big part of the work that we're doing these days is trying to ensure that for all of us, we want to be able to age in place, stay in our home. For some, that's difficult to do considering the condition of their home.
And when you're talking about an aging population, dealing with seniors, dealing with veterans in those situations, health plays an even larger role. It's one
Hmm.
thing for a 30 something to be in a house that maybe has a leaky roof and they're able to patch it so that it's not as terrible. But when you're talking about a senior citizen or a disabled veteran who can't make those fixes and now there is mold, their age is already impacting what their health is going to look like moving forward. It can cause a myriad of problems.
Oh, yeah. Yeah, absolutely. Yeah. Being able to have a functioning kitchen, a stove, maybe the stove isn't working anymore and they haven't really had family that can help them. A leaking roof that potentially has turned into mold, which becomes extremely expensive to try and remediate. When we have the opportunity, when we can help folks, and we have some good, really good volunteer groups. There's local businesses that have teams that will come out and help us with some of our repair projects. And everyone gets the opportunity to feel like they've accomplished something that has truly made a difference in a person's life and is going to allow them to have a higher quality of life, to be able to get around their home safely, and to be able to live in a space that they've probably paid it off. And now it can be healthier than maybe it was previously to the repair that was done.
I think sometimes that's the hardest thing for people to be able to wrap their heads around who've never either themselves been in that situation or had friends or family members who were in that situation. I remember a couple of years ago, you guys had applied for an impact grant through United Way, and we do site visits for those impact grants. So my impact grant panel came out to one of the homes and we got to meet the homeowner. And we heard about the fact that you had done a new front porch and I think a ramp. He wasn't even able to leave his home because he couldn't get out his back door because the porch was not really accessible for him. His wife had knee surgery, I think it was. And you just don't think about those things until you're
Mhm.
standing in front of the person who's telling you all the things he couldn't do that now he's able to do.
Yeah.
And now he can be such a productive member of society where
Yeah.
before, not so much.
I'm thinking of a gentleman that had a stroke and his wife is his caregiver, and he was having a difficult time being able to get out of the house and go to doctor's appointments. And it puts a strain on the wife, and being able to have a ramp that she can wheel him down. I mean, get easily to the car, get in the car. It just makes all the difference. And it's not just for the person that needs it, but again, it's for the caregiver to make their life better. And yeah, I mean, if you're not in it, sometimes you don't know the difference that can make. But the other thing that I would say is, and you had mentioned veterans, we try to do a lot of work supporting our veterans. And some of the programs out there that we're able to access require the veteran to be, if they're disabled, that it has to be service related disability. We want to always help any veteran that we can, service related or not, right? I mean, they've served our country, but we also have to fit within whatever the grant requirements or restrictions are, which we do. We always honor that. But we're working with a veteran right now that has children and is working hard, the promotions at work and going to school, and his wife's going to school, and he's got a service related disability. Just to know that some of the repairs that we're doing for this family is going to make so much of a difference for the kids and the parents. And they're so incredibly appreciative. It makes it easy to do the work.
And I think we were talking about this in the beginning of our conversation too, when you're talking about affordable housing, which is the huge buzzword now, has been for quite some time. I don't think people also understand that it's very hard for our school systems to recruit teachers that can't live in the school system, in the school district that they're teaching in. We're talking about bank tellers. We're talking about the people that are checking us out at Walmart, at the grocery store. These are people who are essential workers that can't afford a roof over their head that belongs to them.
Yeah. Yeah, absolutely. And those are the individuals, they need housing. We all need and want housing and decent housing. And we should all be able to have decent housing where we're not paying more than 30% of our income is going to housing. Unfortunately, that's not the case primarily for our lower income working families. They're upwards of, well, United Way knows this, upwards of 40, 50% of the income is going to housing. And our families and individuals, they will go where the housing is affordable. And sometimes that's 20 or 30 miles away. So they've got the housing that they're in and it's meeting their needs from a affordability standpoint. Maybe close, maybe instead of 50% of their income is going to housing, maybe it's 40%. But the transportation, the amount of time, the wear and tear on their vehicle, if their vehicle breaks down, as opposed to if there's available housing within a city that has public transportation, you can get around better, and maybe it takes you 10 minutes or 15 minutes to get to work as opposed to a half hour, 45 minutes. All of those things ripple out and impact not just their housing and their ability to take care of their children, but also their ability to show up on time for work. And all of those things end up being connected and matter for our families.
And it all comes back to your topic, which is their health.
Yeah.
Because if you're pressed for time, you're more likely sometimes to go through a drive through. So you're not eating
Yep.
the healthiest. You're stressed because you've got this commuter, you got to get to kids' school and then you got to get to work. And so your mental health isn't always at its peak. It does filter into all of these other health related issues that could
Yeah.
be solved if affordable housing was available in the area that they needed or wanted it to be.
We have a woman that's living in a mobile home and has challenges with mold, and it's very difficult to find the funding and the resources to address that. One, it's very expensive to remediate mold. Some funding will only provide if the person owns the land. And a lot of our mobile homes, they lease the land that their mobile home is on, which makes it more challenging. So every situation is, I don't want to say is unique, but has a uniqueness to it. We're always working to try and figure out, how can we get to the yes? How can we get to a place where we can help this person out? And as you said, this year we're focusing on housing is health, because I do think that people don't always think about the connection between housing and health. And that's something that the Housing Coalition wanted to bring forward this year, kind of shine a light on that. And then identify, what does that look like? But then what might be some policies or ways to address that and have some solutions. The problem is enormous, but we're doing good if we can find ways that we can push and pull levers here and there to make things a little bit better.
And
So,
that's the whole point of having a summit like this. It's not necessarily to bring people into a room and hear doom and gloom.
mhm.
It's to bring people into a room and say, look, this is the reality of our situation. So now let's talk about, how do you eat an elephant one bite at a
Yeah,
time? So let's
right.
talk about the different bites and who in
Yeah,
this room has experience with what, and how can you guys partner up if you've got nonprofits or you've got contractors. You've got three great expert speakers that are
yeah.
going to be able to say, well, they did this in Charlottesville and this is how it worked. All of those kinds of things. It really makes the summit, it creates a lot of synergy.
Absolutely. It's bringing high level research experts in the field together to hear what they're doing, what they've found successful, approaches they're taking. And the afternoon session will be a panel of these three individuals. So it's also going to be interesting to hear the three individuals, the three speakers, addressing questions that folks have in the audience. So yeah, it'll be a really good day. I would encourage folks to come out. It's a free event. We do require registration because we're providing a continental breakfast and lunch. And we do ask that if you are going to attend, we ask that you register so we make sure to have enough lunches and food available for people. But if you are planning on leaving early, there is an option in the registration that I'm going to leave early. We won't order those lunches. We definitely want folks to have it. We've got great sponsors. Virginia Housing has been a sponsor of the Housing Summit for the last several years. They're a great partner for many of us doing work in the affordable housing world. So big shout out to Virginia Housing. They will be coming and helping with the welcoming in the morning. Also, Valley Health is a sponsor, First Bank, and then we've got Laurel Ridge. Really excited about our sponsors and very appreciative of their support. And again, I would encourage folks to come out.
Is there a website that people can go to learn more about the summit and find the link to register and that sort of thing?
There is, the website is Housing NSV, Housing Northern Shenandoah Valley.org.
So your event, your housing summit is happening Friday, May 29th, again, 8:30 to 2:30 p.m., Laurel Ridge Community College in the Corone Community Development Center.
Yep.
Free, but registration is required. And then Shenandoah County is also hosting one the following week on Friday, June 5th, has a little bit different of a focus. So it would be great for people to come to yours, learn all of this stuff, and then go to theirs and learn all of their stuff.
Yes. Yeah, absolutely. And we're excited this year. We had a conversation with the folks in Shenandoah County, and they had said, hey, can we do a housing summit down here? And we're like, yeah, absolutely. And so they've really taken the reins on this. And as you said, they're doing one on Friday, June 5th in Edinburgh. And their focus is going to be connecting builders, communities, and local lenders. They recently did a housing study in Shenandoah County and Woodstock. And so Mel Jones, who's with the Virginia Center for Housing Research at Virginia Tech, will be speaking. The chief economist from Virginia Realtors, Ryan Price, will be speaking. And then they also have a panel discussion with Housing Forward Virginia. So again, really good speakers. We'll probably have more of a rural focus to it, but such a huge portion of our region is rural. And it's an important aspect of housing when we look at, again, transportation, things that really impact that whole housing health connection.
And even though that one is going to be more Shenandoah County focused, much like we were talking about earlier, it doesn't mean somebody from Winchester or Frederick County can't go there and glean information that they
Oh, for
could then
sure.
come back to Frederick County and apply, or the city even. So it's great to gather that info wherever you can.
Yeah, Ryan Price, he typically will do a statewide kind of looking at the real estate market and world from a state perspective and then start drilling it down, which I always find that's always extremely fascinating to see what is the real estate market looking like currently. We know it's certainly changed over the last many years and housing stock is low and the number of days that a unit stays on the market is way different than it used to be. It's really, really interesting. And the other thing I would say is it's typically been my experience, but our speakers are always happy to answer questions and be a resource. They're just wonderful to connect with afterwards. And again, I would encourage folks attend both. Both of them are free events. The Shenandoah County one, they do have a link to RSVP.
And I'll put that link in the show notes page. So I'll find that, and then I'll put the link to that one in the show notes page as well. So people can click through and register for both events.
Yeah. It's going to be really, really good information for all of us here in the Valley trying to figure out the housing challenge.
Thank you for taking the time today to give me some background and some information on both of these housing summits. I do appreciate your time.
Oh, you're very welcome. Thank you, Janet. It's always great to chat with you and get the word out. We encourage folks come and attend.
Well, that's it for us today. I will be back tomorrow with a brand new episode of The Valley Today. Going to introduce you to Laurel Ridge Community College's two outstanding graduates, one from their Middletown campus and one from their Fauquier campus. So meet me back here for that just a few minutes after noon.